So now we're going to apply that math that we just calculated and prep our syringe pump. So first we're going to check our order and compare it to our MAR. So our order was for 200 milligrams of vancomycin through syringe pump. Perfect, and that matches. I'm also going to check my allergies and my lab reports. Because the syringe pump is a form of IV medication, fluid and electrolytes is super important. We also want to consider the medication itself. So vancomycin is an antibiotic, so we want to check the CBC, check our white blood cell count, things like that. We also want to research the drug, so we want to check the classification, mechanism of action, and all the information about it, and if there's an antidote. Then we want to check an IV resource for drug compatibility. So in this case, we have sterile water with vancomycin, so we want to make sure they're compatible when we give those together. We want to check to make sure we're giving the right diluent, and all of that can be found in the black resource book that we just used for the medication. So we are going to start with hand hygiene. 15 seconds, and we're going to get our medication. And in this case, for reconstitution, we're going to get our diluent. So I have my vancomycin. It says that it's 500 grams. And I have sterile water. So I can go ahead and swab the top of my sterile water. Let that dry. In the meantime, I'm going to open up my needle, set that up, and I'm going to draw out 10 mils of diluent. Perfect. Now I'm going to pause the lid on my med. And we're going to swab that as well. We'll let that dry. And then we're going to inject our sterile water. And I make sure to get it all around to help break up the powder. We're going to shake that to make sure that it's fully incorporated. And I'm going to give that a second to fully dissolve. In the meantime, what I'm going to do is I'm going to get my syringe. So I have a 60 cc. And then I'm going to grab a needle and attach that. So based off of our math, we calculated that we're going to need 36 mils of diluent. So I'm going to go ahead. So I'll swab the port. Inject my air. And then I'm going to block. So I have my 36 mils of diluent. I'm going to remove. So I'm pulling back That way, when I add my medication, I have room. So I'm going to take my medication now, my vancomycin. I'm going to swab it. And I'm going to draw up what we calculated, which was 4 mils of medication. So now, take my syringe, make sure I have enough room, and then inject this. And I'm just going to take a swab and mix the two. So again, I'm performing my checks. I have my vancomycin. I'm going to remove all of the air. And I want to make sure that I label. So I'm going to label my syringe with the name of the patient, the name of the medication, dose, the date, my initials, and the time. And then I also want to make sure that I label my tubing with my initials, the date, and the time. With our syringe pump tubing, we want to make sure that we have max zeros attached to the ends. That way this remains a closed system and it's sterile when we are attaching our syringes to it. So now I'm gonna go to the patient's room. I'm gonna go introduce myself, ask for consent, and then proceed as usual. So right now we're going to do the aspect of the CPE where we're connecting the syringe pump to an existing IV. So it's super important with this one that we enter the room, we check the pump for what the primary pump is currently running. We want to check the medication, the rate, and we want to verify it to make sure that everything's okay with that. Then we can proceed with the syringe pump aspect. So I have all of my materials ready. And I want to make sure that I enter the room at this point. Hello, my name is Reem Boudali. I'm a 4th year nursing student at the University of Windsor, and I have your medication for you.
Oh, what medication is it?
This is actually vancomycin, so it's an antibiotic. It's part of your medical regimen to help with the infection that you're currently fighting.
Okay, that makes sense.
Is that okay with you? Can I set that up?
Yep.
Perfect. So before we begin, I just want to verify your identity. So can you tell me your first and last name?
Yep. Crisscross.
Perfect. Your date of birth?
April 1st, 1959.
And what pronouns do you prefer?
He, him.
Perfect. So is it okay if I call you Chris today?
Yep, that's fine.
Wonderful. Chris, do you have any allergies at all?
Not that I can think of.
Perfect. All right, I'm just going to scan your wristband. I'll grab some gloves and I'll be back.
All right, sounds good.
So I scanned the patient's wristband. Now I'm going to make sure that I scan my medications. So I'm going to scan my vancomycin vial, my sterile water, which was my diluent, and my pretend sterile water. I'm going to do my 4th check, make sure that I check my 6 rates of medication, and then I will proceed by giving the medication. So I'm just going to check a couple things before I get started. So I noticed that you're running 500 mils of normal saline at 50 mLs per hour. I checked your chart and it looks like that is ordered and that is correct, so we're good to go with that. I'm just going to check your IV site, okay? Is there any pain at all? Have you noticed any swelling, redness?
No.
No? Okay, perfect. All right. We'll get set up then.
We're going to start by turning the pump on. While it's turning on, we're going to go ahead and scrub the hub of the Max Zero and connect our tubing to our syringe. Now that that's ready, we're going to go ahead and click OK. We're not going to use the last therapy. And then we're going to open up the latch by pulling it out and to the right, and then move the screen downwards. You'll notice that as we pull the latch, this little green tab pops out, and that's a little space for us to put the flange. But with these big 60cc syringes, you'll notice that you can't put the flange horizontal, or else it'll block the latch, so just rotate it when you put it in. It's going to auto-detect the size, so we click OK to the 60cc, and the arm is automatically going to move in. Now, because we didn't manually prime our line, we're going to go ahead and do that right now by clicking the bolus button. Alternatively, before you put this into the pump, you can just press on the end of the syringe to manually prime the pump. Once that's complete, we're going to go ahead and input the values that we calculated with our math. So for our rate, we had 40. For our VTBI, we also had 40. And because we inputted 2 parameters, it's going to auto-populate the third, but we always want to check this with our math.
Now that this is good to go, I'm going to swab off the port that's closest to the patient. And then I'm going to connect. And then I'm going to click run. So start. And now it's running. So I'm going to come back in an hour once it's done completing, and then I'm going to flush the line. So it's been an hour and I'm going to switch it out now.
So we're going to click stop for this scenario. We're going to pull out the latch and just let it go, and that's going to tell the pump that we want to do a syringe change. So we click yes, and it's going to open up the arm. That way we're able to remove the syringe. Once the arm is out, we're going to go ahead and pull the latch out and to the right, then open the screen and pull out the syringe. We'll twist it off, and we want to make sure that we scrub the hub before we attach our saline lock. Make sure that you remove the air from your saline flush before you attach it. If you don't have a 3 ml flush for a peripheral IV and you only have 10 ml flushes, you can still use the 10 ml flush. Just make sure that you only input the VTBI to be 3. Once your flush is in, the arm will again sense the distance. For a 3 ml flush, it will think it's the same size as a 10 ml flush, and that is okay. So we want to make sure that our rate stays the same because there's still some medication in the line. We want to focus on the VTBI. So we're going to go to VTBI, and for a peripheral IV, we're going to change it to 3. And if it's a PICC line, we change it to 10 mLs. Once we click OK, you'll notice that it will be the time that changes. And we should think if it's a logical amount of time compared to the VTBI and rate that we're running. So we'll run the flush and come back in 5 minutes once it is complete. So our 5 minutes have completed. We're going to go ahead and disconnect our tubing. We want to make sure that we sterile cap the end so that the line remains sterile. It's good practice to always turn off your pump after use. So just like you did before, do a syringe change and remove your syringe. And once that's complete and the pump is completely empty, then you can go ahead and power off the pump so that it returns to its starting position.
We want to check up on the patient after the treatment and make sure that they're okay, that the IV site hasn't infiltrated or anything. So that's it. And then you're good to document on the infusion record. Now we're going to go over the part of the CPE where we connect the syringe pump to a saline lock. So I'm going to go in, introduce myself to the patient, and scan their armband. Hi, my name is Reem Boudali. I'm a fourth year nursing student at the University of Windsor. I go by she, her pronouns.
Hi, Reem.
Is it okay if I get your name?
Yep, crisscross.
And what are your pronouns?
He, him.
Perfect. Is it okay if I look at your armband?
Yeah, go ahead.
Can you tell me your date of birth?
April 1st, 1959.
Perfect. And do you have any allergies?
Nope.
Awesome. So I do have your vancomycin that's going to be given through your syringe pump. Are you aware of what vancomycin is?
Kind of.
So it's actually an antibiotic, and you're being given it for your infection to help clear it out.
Okay, that makes sense.
Do you have any questions at all?
No.
So are you okay if I go and get that prepared?
Yeah, go right ahead.
I'm just going to scan your armband first really quickly.
Mm-hmm.
Perfect. I'll be right back in.
Alrighty.
So I scanned the patient's wristband. Now I'm going to make sure that I scan my medications. So I'm going to scan my vancomycin vial, my sterile water, which was my diluent, and my pretend sterile water. I'm going to do my fourth check, make sure that I check my 6 rounds of medication, and then I will proceed by giving the medication. I'm going to just perform my hand hygiene. Put on the gloves. And then I'm going to grab all my materials. So I'm going to start by programming my pump. That way I have it primed and I'm good to go as soon as I get started. So on my pump. While I'm waiting for that to open, I'm just going to assess the site. Have you been experiencing any pain, redness?
No.
Any swelling?
No.
Looks and feels all right? So I'm just going to swab my max 0 and connect my syringe. Now I'm going to open up and attach my syringe. It is a 60 cc syringe, so I'm going to continue. Making sure that I keep the ends above my waist. I'm going to input everything. So we're running at a rate of 40. And our volume to be infused is also 40. So it auto-populates that the time it takes is 1 hour, which is correct. I'm just going to prime my line. I'm good to go. So now I'm going to scrub the hub and flush my line. I'm going to pull back and remove the air bubble. And then I'm going to put my fingers above where the end of the catheter finishes, and I'm going to feel to see if I feel that flush, which would mean that it's in the vein. Perfect. And now I'm going to connect my syringe pump. Once that's all good, then I'm going to click start on my infusion. And that's going to run for the hour, and I'm going to return, and then I'm going to flush the line. So it's been an hour and my infusion's complete, so now I'm going to change out my syringe. So I'm going to pull out. It's asking me if I want to perform a change. Yes, I do. I'm going to remove the old syringe. And I have my swab. Then with a new flush, I'm going to pull back, then remove the air, and connect it, and then add it into the syringe pump. It's automatically going to sense that it's a 10 ml, but we're only flushing with 3, but that's okay. And because there's still some of the medication that we gave within this tubing, we want to make sure that it runs at the same rate. So we're not going to change the rate, but we're going to go down to VTBI and change it to 3 because it is a peripheral IV. It tells us it's going to finish in 5 minutes, which sounds about right. And now it's going to run. Once that is complete, so it's been 5 minutes, our infusion has stopped. We are going to disconnect and grab a max 0. So I will scrub and attach my max 0. That way the line isn't open if we have to reuse it, and it's considered sterile. I also want to assess the patient to see how they're feeling afterwards. Hey Chris, how are you feeling?
Never felt better.
Okay. No swelling, redness, pain, or anything?
No, none of that.
Perfect. All right, I'm just going to go and document that I did this on your infusion record. All right. Your call is right next to you. Please let me know if you need anything.
All right, thank you so much.
Bye-bye.
Bye.